This is the Level 1 Rapid Infuser. It is used for massive transfusion of blood products and crystalloid fluids for prevention and treatment of clinical shock. Common clinical scenarios in which it can be used include major hemorrhage, trauma, and placenta abruption. This is a one-person job, and while using this machine, you should not be expected to take part in any other task. It can look overwhelming, but just think of it as 2 pressure bags and a fluid warmer. Now, prior to using it, you want to make sure that you plug it in. I would also advise that you put your red bin right next to level 1. This will help with priming your line and also when you have to switch out your blood bags. Now, this is the level 1 tubing set. There are instructions on the back of the box to help with use. Now, before we spike any fluids or blood, we want to close all the clamps, just like if we were going to hang any blood. Then we want to do a thing called burping the fluid or burping the bag. This is done by spiking the bag, then remove our tubing. Then we want to remove any extra air from the bag and then respike the bag. We do this both with the first bag and the second bag. This will help to reduce any risk of introducing air into the line and therefore your patient. Now we do this anytime we put a bag of fluids on pressure. Next, we need to hang both the bags in their fluid pressure chambers. These are your pressure bags. There are different hanging levels within each chamber to help facilitate the use of different size fluid bags. Once we do that, we close the door and seal the unit. Now the heat exchange unit can be secured into position. Next, we take the lower part and we slide it into dock number 1. Next, we take the top part and we slide it into number 2, and then we pull number 2 down. Both number 1 and number 2 can take some force to push into. Now the blood filter is fitted into dock number 3 and 4. Now we want to make sure that the gas filter is pointed upwards. This will help allow a gas escape. Now sometimes it is easier to put number 4 in before number 3. That way we want to make sure that we don't pinch the line of our tubing. Now we just need to prime our line. So we open our clamps and then we prime our line with our saline just like you would normally do with giving blood. Once our saline's primed, we clamp our saline, then we open our blood and we run our blood through. Making sure that we only have one clamp open, just like we normally would, to make sure that blood does not flow into our saline or saline flow into our blood. Now before we switch on the machine, we need to check that the reservoir is filled up to the appropriate level. This machine requires distilled or sterile water only. We do not put saline in this reservoir. Now to switch on the infuser, we press the green button. It will beep as it goes through the system check. The beeping should stop. If it continues to beep like in this video, it means there is an issue with the system. Most of the time it is due to the blood filter not being pushed in completely. Now once you push it in, the beeping should stop and the system will start to heat up. Once the display screen indicates that the water temperature has reached above the normal body temperature, we can unclamp the first bag, then turn the pressure chamber on. The next step is connecting the tubing system to the patient's IV. The tubing system is very heavy, so you may want to secure it with some tape to make sure that we don't dislodge the IV cannula. Now unclamp the roller clamp to commence the first infusion. Once the first bag is empty, turn off that pressure bag and clamp that tubing. Then you unclamp the new bag and turn that pressure bag on. At this time, you can switch out the empty bag with the new blood products. And that is how you use the Level 1 Rapid Infuser.